So, hi, good evening. Hi, all. Welcome to the masterclass. Hi. So, hi. Hi, Kiranmai. Thank you for joining. Hi. Hi, Chandu. Thank you for joining. Hi, good to see you all. So, we'll just wait for the other participants, other attendees to join, and we'll start the program masterclass within 5 minutes. So, meanwhile, if you have any questions to be asked about this masterclass, you can just drop a message in the chat section where I would be like answering to all your questions at the end of the program, at the end of the masterclass. So, hi, Krishna. Good evening. Hi, all. Hey, Milan. Hi, good evening. Hi, Mr. Venkateshwar Lu. Hi. I can see raised hands. So you can drop a message in the chat section so that I can answer all your questions. Hi. So we'll just wait for another 2 minutes and we'll start with the master class. Hi, Sundira. Thank you for joining. Good evening. So, like every Saturdays, we do have this masterclass on IBS with the wellness coaches, and at the same time, on with the certified nutritionist. So you can always, we will be giving you a prior information for registering to this masterclass. And if you have any suggestion with the topics, like if you want to, want a particular masterclass, any on the particular topics, you can just feel free to suggest. So we can just include in the next masterclass. Hi, Kirti. Thank you for joining. Yeah, I guess we are good to start. So, hi, myself, I'm Ooha. I'm a lead nutritionist coach from Daily Bloom IBS, working with an experience of 5+ years. So, today's masterclass is all about the science behind the IBS and the diet. So, I would be explaining more depth into relationship between the IBS and the dietary modifications and the habits. Um today's masterclass is all about like how certain foods triggers your IBS symptoms and how it can be managed, like the management and the food changes which you can do in your, everyday routine diet plan. And also we would be discussing more about the importance of low food map diet. So FODMAP, basically fermentable oligosaccharides, disaccharides, monosaccharides and polypols. So these are helps in reducing high food. We can just include exclude all the high food map options and would be helping you like how to include certain exclude certain fermentable carbohydrates and also exacerbate your IBS symptoms. And also I would be explaining about the role of gut microbiota and other lifestyle management factors which would be helpful for IBS patients. So coming to the definition, as everybody would be knowing, like according to the World Gastroenterology Organization, this defines like the irritable bowel syndrome is a functional disorder. It's not like a disease or something. It's just a functional disorder where it causes a lot of discomfort associated with the defecation and also change in the bowel habit. Like there might be a chances of constipation or diarrhea or bloating or any of the gas formation, abdomen pain and all. So coming to this irritable bowel syndrome, so this is the remains the most common gastrointestinal disorder seen like in the both the primary and the secondary care. So the prevalence in the IBS in the global population is estimated to be around like 11%, or in Asians it ranges from about like 4% to 9%, depending on the criteria used. And the prevalence of IBS in women is about like twice as higher as in men, as it make up to like 80% of the population with the severe IBS symptoms. Then, however, there is no like sex differentiation in this, South Asia and Africa. It might be IBS can be like happening to any of the gender. Then half of the patient like reported in the first symptoms before the age of 35. So before I would be like walking you through more about the science about this IBS. So it's basically a disorder, as I have told you already, to a gut-brain axis interaction. So it's a mainly in this multi-factorial pathogenesis of IBS. Key role is played by disorders of gut-brain interactions. So the intestinal microbiota is essential for this element of these interactions, and also epigenetic changes, infections, or early adverse life events may even predispose in triggering this IBS symptoms. So would be like explaining a small pathophysiology about this IBS. So as I have already told you, it's a gut-brain axis it all depends on the gut-brain axis interaction. So IBS is a disorder of like, altered bidirectional communication between the gut and the brain. So it's basically called as via the gut-brain axis, and it's a psychological etiology. So before I could explain about this, like whenever you are like preparing for an exams, or, preparing for any of the big day event of yours, you actually feel that gut quenching experiences in your stomach. And also there are like certain situations where it makes you like nauseous. And also when you are like thinking about your the first crush, or when you are like entering into any of the relationships, so there will be a slight different feeling in your gut. So had you ever thought about this? So this is basically all about the stomach. Ever thought about, as I like told you, the stomach interacts with it. So because your brain acts as your second brain, I mean your gut acts as your second brain over here. So coming to the science of this, in the nervous system of gastrointestinal system is called as enteric nervous system, which in turn it leads to is and have been like it's not even like about where this nervous system, the enteric nervous system, independently this regulates the the digestion and absorption functions, which where there are almost like about in this enteric nervous system contains almost like 500 billions of neurons. These neurons will help in synthesizing this neurotransmitters, where extrinsic nervous system would be like helps in accessing this nervous system through the vagus nerve. So where you will be facing the symptoms of this either symptoms of IBS. So the brain and the gut are not only attached physically, but also there is a chemically attachment, there's a biochemical attachment relationship between the gut and the brain interaction. So As I have mentioned in this currently, as you can see, the major components of complex pathophysiology includes this central nervous system and autonomic nervous system modulation, altered visceral perception, transist and motility, and also immune regulation, inflammation, and epithelial permeability, and the microbiome. And also, as I have already informed you, the intestinal mucosa is associated with this dysbiosis, diet, stress, like endogenous factors, resulting in increased permeability of intestinal barrier, where your symptoms gonna increase more. And also, there is a SIBO, like the small intestinal bacterial overgrowth also would be there here. So coming to this central nervous system disorders, where it would be occurring in the patient with IBS, may be caused due to increased reactivity to stress. So it may be any kind of stress, maybe like work related stress, anything like relationship related stress or influence. These actually factors influence in the severity of your symptoms. So, and also when it comes to dietary factors which particularly emphasizes on the poor absorption, like whatever, when you, though you might be eating the food or taking everything, but there might be a poor absorption of your nutrition, and easily fermentable oligosaccharides, polyols may also influence in occurring the symptoms. And also there might be few other factors like psychosocial factors which coinciding into psychiatric disorders, and there might be other few reasons as well. So coming to the biopsychological axis, as you can see, if your brain is happy, the gut is happy, the symptoms automatically would be reducing. So there is a correlated fact. I mean, there is a overall relation between the brain, gut, and also the dietary habits. And coming to the low food map diet, like food map basically, like when a person has a diabetes, they do actually follow this diabetic diet. Like the same way for the IBS, like the irritable bowel syndrome also, there's a specific diet called low FODMAP diet, FODMAP, where FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyphenols, which are basically called as common group of, known as carbohydrates. So these are again further divided into five groups called as fructans, galacto-oligosaccharides, lactose, excess fructose, polyols, etc. So, so, as I told you, what is a low FODMAP diet? So, whenever you're taking any of your meals, like the normal regular meals, or any of the food items, like a group of sugars, these actually get poorly absorbed in your small intestines, and which again pass to your enter into the colon or the large intestine, where these get fermented by the bacteria. So, which in turn again leads to there would be a gas producing in your intestines, or there will be like little absorption of water, more absorption of water. So the colon gets sensitive to this bowel, causing like the bloating, wind, pain, and all. So again, this can again cause water to move into your colon, causing diarrhea or combination of both. So in few cases, like the symptoms won't be same for all. Like in few of the patients there might be only diarrhea, in few of the patients it might be only the constipation, or in few patients it might be like either a bloating or an abdomen pain. It depends, like it differs from individual to individual. So specifically this low FODMAP diet is for the IBS patients, as I have told you. It's like making a few diet and dietary modification in your meal would like really help you out to get, reduce your symptoms and have an happy lifestyle. So the first line dietary advice should and must for all the patients with this IBS. and which includes like adapting to a healthy life eating patterns, such as a regular meals, like eating meals on time, maintaining the same consistent timing every day, and switching on to a healthy meals options instead of preservative foods. Like when you like enter into any supermarket or something, you see lots of food items like canned food items or preserved food items, and we really don't know what are the chemicals they're gonna add into that and what are the preservatives they're gonna add into that to preserve those food items. So make sure you're eating healthy consumption, like fresh fruits, fresh vegetables and everything, considering like only choosing a low FODMAP options when it comes to your meal plan, and also limiting to alcohol and caffeine intake. Especially alcohol and caffeine must be completely avoided, because the already your intestine is going to be like very sensitive to this condition, and again when you're adding like caffeine or alcohol to your daily, I mean normally taking these things can again affect your gut, and again they're gonna increase your symptoms or trigger your symptoms. And also reducing the consumption of fatty and spicy foods, like spicy foods also triggers to the symptoms. Consumption of fatty foods, it may be like anything like the fried stuff, outside food, anything like something like a cake or confectionery items or biscuits or ice creams, anything like that. So, what steps can you actually take if you have this IBS, like the irritable bowel syndrome? We usually recommend to have like a three regular meals a day, the proper healthy meals, and you can even include like two snacks in between. Overall, it should be balanced. So whatever the meals which we would be suggesting would be based on your height, weight, the amount of calories and protein and fiber should actually go into your meal plan would be considered over here. And also try not to skip your meals. Like skipping your meals is one of the highly observed it might actually trigger your symptoms, making you feel bloated, like acidity also might be there. So also make sure you're having like a small, you can see at a time if you're not able to have large meals or something, you can again switch on to small frequent meals, and you can actually balance your meals and reduce, as I already told you, reduce the caffeine containing drinks. And especially you need to see, there might be like there are like few people who have the habit of drinking tea, coffee every day, like 5 to 6 times or more than that. So you can just reduce it to like maybe two number of times, or 2 to 3, not more than that. And also reduce the intake of soft drinks. So soft drinks specially contain lot of sugars and preservatives in that, which might also like trigger your symptoms. And also drink at least 8 cups of fluid per day, especially water. Water is really important to help you in the digestion, keep your body hydrated and all. So not only like water, you can just switch on to all those, herbal teas or buttermilk. You can have detox waters, something like, ginger water, mint water, anything like chia seed water. It's all about according to your comfort. Then cut down on the rich and fatty foods. As I have already explained you, rich and fatty foods in sense, all the food items, like all the packed items or the preserved items which contains lots of sugars and fats in them, like something like cheese, cheeseburgers or french fries, something like pizzas, all maida products, everything should be avoided. And also reduce the intake of manufactured food, as I have already told you. Like when you enter into a supermarkets where you can see lots of packed and preserved items like the chips or anything like that, just try to avoid all those, and like switch on to meals which are like freshly cooked at home. So freshly cooked, what actually happens is you will get to know like what are the food ingredients you have added into that, and what are the oils you have used in your cooking, or like how much portion you were able to cook, and what are the masalas, or for tasting, for the taste, what are the food items you add into it. But in the outside food, we won't be able to make it out like what are the things they have added into that. But always it's preferable to have only the home cooked meals. Next, coming to some of the helpful tips where you can, follow to reduce your IBS symptoms, like take time for yourself. Like you can just indulge into either yoga or any of the, physical activities like cycling, swimming, any massage therapies or aromatherapy. Like it all depends on the individual, whichever you feel comfortable, calm, peace, and all. You can just indulge into those activities and take time to eat meals. As I have told you, in this busy schedule, there are people who doesn't eat food on time, actually try to skip their meals and doesn't, stick on to either of the timings every day. So there are people who just have only one meal per day. So I would definitely recommend to have at least 3 meals per day and chew your food well. So when chewing really helps in the proper absorption of food in the body, and also the malabsorption, everything would be avoided over here. And also keep a food and symptom diary wish list while making changes, so that you can see what really helped you. So this is like very, very, very important when it comes to, your FODMAP diet plan. Like there might be few people, like agar when first of all, like when you are like starting a meal plan, you just note on all the food items, like whatever you had in your breakfast, lunch, and the snack timing, whatever you had, just make a note of it, so that you'll get to know, like next day when you just try the same food, or if you have any triggers, like after having any of the food items, like there might be not be a immediate triggers, maybe after 2 days if you face any of the triggers, you can again get back to whatever you have noted, and you can just check on it, like okay, this food has caused this food has caused this, or otherwise this is not suiting me, or if I'm eating this only on this particular portion sizes, I'm able to, control my symptoms. So this all will really help you out. So always make sure whatever you're eating, just keep, this will really help you to track your meals as well, and you will better understand like what are the foods you can eat and what are the foods you can avoid. Then coming to some of the helpful tips, which is usually for the patients, like there might be patients, as I have already told you, there might be only bloating in few patients, and there might be like only constipation in few patients, and also there might be only abdomen pain or bloating in few others, or there might be a combination of both as well. So in such cases, if symptoms include only the bloating and abdomen pain, so bloating is basically it's a fullness of your, stomach, or there will be like a heavy to mild pain which will be eradicating in your, abdomen. So in such cases, you can just limit the intake of gas producing beans. So beans in sense, anything like something related to rajma, nahi to chole, and all this. This can be taken in limited portions. So portion sizes, having meals in the portion sizes will really help you out with this IBS symptoms. So for example, as I told you, all these symptoms. So if you are really fond of rajma, so if you want to include those rajma in your meals, so you can just include either a small portion, like in today portion, you can just include only 1/4 portion, and maybe tomorrow you just slowly, you can just increase the quantity to half portion, and or the, the next day the full portion. So having a portion vises like this will really help you out to track on your symptoms, like how much portion were you able to, tolerate. You can just make it out when you're having in the portion sizes. But people with really bloating and abdomen pain need to avoid, the gas forming beans, especially, and limit the portion sizes, as I have told you. And the next helpful tip is about the constipation. So constipation mainly is like when your bowel movements are only like in a week, there are like limited only 3 bowels, or less than that. It's basically considered constipation. So this in this condition, we need to like gradually increase your fiber intake. So fiber intake, in sense, it can't be like given at a time, because if you are taking a lot of fiber at a time, that your stomach won't be able to, gut won't be able to balance that much of fiber, and again there might be a chances that your symptoms might trigger. So in such cases we need to, gradually increase, like slowly we need to increase your fiber intake, so that according to the adaptability of the gut, slowly we need to increase the fiber intake. So the rich sources of fiber mainly include this whole grains, oats, vegetables, all the fruits, and all the low FODMAP options, fruits, veggies, and everything you can add. And also taking fiber will really help you to soften your stools and make it, easily pass, which would be like really helpful with the patients with constipation. And coming to the symptoms, which include diarrhea. So diarrhea is basically watery stools, where you will be like observing like 2 to 3 watery stools per day is considered as diarrhea. So in such cases, you need to try reducing high fat foods. So high fat foods in sense, basically these are the confectionery bakery items, or else cakes or biscuits or milkshakes or anything like that. So you need to reduce that and replace with lots of fluids. So fluids in sense, you can have lots of, anything like mint water, detox water, lemon water, something, or else buttermilks, something like this. And limit caffeine intake from the tea, as I have already informed you, coffee and soft drinks, you know, all this must be limited. It would be really helpful if you are like switching on to lactose-free options like the almond milk instead of cow milk, buffalo milk, and all this. You can just switch on to almond milk, walnut milk, any nut-based milk, considering again the low FODMAP options, and avoid sugar-free foods, sweets or mints or gums, drinks. Okay, there will be there will be options of sugar free items and all that, but actually that contains this artificial sweetener and all. Again, it might, trigger your symptoms more. Which contains, as I told you, like the sorbitol, mannitol, xylitol. These are all the artificial sweeteners which are like included in this. This again will actually trigger your diarrhea symptoms. Okay, and also these are the few food items you need to be avoided. Like as I told you, FODMAP basically stand for fermentable oligosaccharides, disaccharides, monosaccharides, and polyphenols. These are the fructan group food items, like the wheat, rye, barley. These are the few examples, like the garlic, onion, lentils comes under these groups, lentil, chickpeas, legumes, and all the cashews and everything. These are the few examples, just for your understanding. Then coming to the galacto-oligosaccharides, all the bean groups or the lentil groups like the chickpeas, soya beans, rajma, chole, all this comes under this galacto-oligosaccharides. Then coming to the lactose food items, all the animal milks like the cow milk, buffalo milk, anything made out of that, the curd, paneer, custard, yogurts, and also the ice creams, condensed milk, dairy products, all this contains, lactose. So I would highly recommend to avoid all these food items. But if you are trying once, when you're starting with this low FODMAP diet, so initially there will be like an elimination phase where would be avoiding all the food items, something related to, milks, normal cow milks, buffalo milks, and all that, and also the wheat products and the onion and garlic, where after that we will be like entering into this reintroduction phase, where we can again reintroduce this milk and everything, but like very in a portion sizes, like in a limited quantity. So it all, the nutrition is going to really help you out with your low FODMAP diet. And next comes to this excess fructose. So excess fructose mainly present in high FODMAP fruits like, apples, pears, mangoes, guava, honey. Again, these all gonna have, trigger your symptoms. So I would recommend to, limit. Actually, there will be few food items which you can have, but in a limited portions only. That also would you would be definitely need a nutritionist advice over here to taking such kind of foods based on your, uh, you know, eating habits, your routine, and everything. Um and next would be this polyols. Polyols, these examples basically includes these peaches, plums, cauliflower, mushrooms, chewing gums, and all the confectionery with polyols. So this would be something like this. So if you have any questions or if you want to ask anything, can you just you can drop in the chat section so I can answer all your questions. Yeah. So we do have this Daily Bloom's IBS program where there will be a certified nutritionist, at the same time wellness coaches who would be like wellness coaches basically will help you out with the brain gut axis functioning techniques, all the yogas to actually reduce your symptoms. And also coming to the diet part, nutritionists, we have a team of nutritionists and at the same time wellness coaches who would be like helping you with the diet plans. And it would be a customized diet plan. It would be the same for all. Like if I have an IBS and other patient would have an IBS, both the diets won't be the same according to their eating habits, their likes and dislikes. Considering everything, we would be making a customized diet plan where you would can enjoy all the food items which you were avoiding all these days. So for example, if you like a biryani, I know there would be a lot of people who would be like fond of biryani, so they can actually enjoy the biryani, but a little preparation method would be different, and at the same time the portion control also matters over here. Okay, so there's a question from Mrs. Okay, Sneha. So, can I have apple in this IBS? Yes, definitely you can have apple, Sneha, but there will be a reintroduction phase as well when it comes to this IBS low FODMAP diet. So, where we would be giving a particular portion sizes for you, then after that, slowly you can include, not like a full portion or something. We'll just check on the symptoms and you can include in your meal as well. So there's also a question about the curd and the buttermilk. Can I have a curd and the buttermilk? So initially, it won't be recommended to have a normal, lactose like normal curd, like the cow milk or the buffalo milk, and the curd made out of that. You can just switch on to lactose-free options like almond milk, walnut milk, and all that you can have. You can set curd out of that, and you can have initially. But when it comes to the reintroduction phase, again, we're going to start with the small portions of, curd and milk. Then after that, you can just include in your meal slowly. Can also there's one more question from Mr. Murali. So can I have chicken and non-veg in this IBS condition? Yes, definitely you can have chicken and everything. But here, as I have already told you, the portion size over here matters, and also the preparation method initially would be different. We would be giving you a proper recipes along with how you can make it, like how much quantity you can use it, and you can happily enjoy this biryani. Yeah, non-veg and everything. Are there any questions? Any other questions? Okay, so as I told you, like every Saturday there would be a master class by nutritionists, at the same time wellness coaches. You can just enroll into the program, and also you can suggest any of the topics, like where you want to know about any of the topics. You can feel free to drop it in the chat section, so we can just have a master class, whatever the topic suggested by you. Whether, okay, we have one more question, like whether curd intake would also be bad for IBS, whether rice intake would also be bad for IBS. No, definitely you can have rice, when it comes to IBS. And curd intake, as I have told you, like initially you can take lactose-free options like the almond milk, walnut milk. There would be some, elimination phase over here. Then slowly we will include a normal curd and all, but only in specific portions. There we can just let you know whether you can have the curd or what type of curd, how much portion you can have over here. Any other questions? I think I have answered all your questions. We'll meet you in the next masterclass again. As I have told you, every Saturdays we do have masterclass for IBS. You can actually join the class, and even you can suggest the topics as well. Yeah. So, thank you. Thank you. Thank you for joining. There's a one more question from Jignyas. What are the symptoms of IBS? So basically the symptoms include there will be like either a constipation, diarrhea, as I have already discussed, constipation, diarrhea, bloating, and at the same time abdomen pain as well. So these are the four commonly observed symptoms in the IBS. Then again, I have told you it differs from person to person. Yeah. Yes. So thank you. Thank you. Thank you all for joining.